At MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center.
Hey everybody, good afternoon and happy new year. Welcome to 2026. This is the first edition of MedsPLUS Medical Minute Live. I'm Dr. Pauline, one of the founders and consultant pharmacists here at MedsPLUS Pharmacy, and welcome to another MedsPLUS Medical Minute. As you can see, I am solo today. Dr. Jennifer is actually in Roebuck, wrapping up one of our last cohorts of our community-based diabetes education classes. So today was their last day. They had amazing information on healthy cooking. A chef from Biddy's Living Kitchen was there to do a healthy food demonstration. And they also received their post-education screenings. And that's where we look at their blood pressure, their blood sugar, and see how it's changed since they started the classes. So we're definitely looking forward to doing more of those courses. If you or someone you know is interested in hosting a community-based diabetes education class for your church, for your community center, for your senior center, for your employees, let us know. Reach out to us. We'd be happy to set up a meeting to discuss how we can perform diabetes education services at your location. So with that being said, I want to welcome y'all to this week's MedsPLUS Medical Minute. I'm Dr. Pauline, and so whether you're watching me here live or you're catching the replay, just know that we're here because your health matters. And as you can see by the title, I want you to really consider New Year, and at the beginning of the new year, all of us make resolutions or promises or whatever you want to call it. But we say things like, I'm going to eat healthier. I saw a post on Facebook the other day that says, I will not eat up my money. And I think several of us have that resolution because we have food at home. But sometimes it's easier just to stop by somewhere on the way home. I definitely understand that. I've seen resolutions. I'm going to pray more. I'm going to make a concerted effort and be intentional about reaching out to my friends and family more often. So whatever your resolution is for this year, I want you to consider whether it's time to change your pharmacy. Think about that. Your pharmacy should not just be a place where you go and have a transaction. Your doctor sends them a prescription, you go pick it up, just like you go and buy eggs or milk. Your pharmacy encounter should not just be transactional. Think of when you chose your primary care provider. What did you do? You may have asked around friends, family, who's your primary care provider? How do you feel about them? How long is the wait? How long did you have to wait to make an appointment with them? How responsive are they to your phone calls, to your questions? You put some effort and some thought into choosing your primary care provider. I want you to know that it's equally as important to put that much thought and effort into who your pharmacist will be and what pharmacy you will use. So in other words, what I'm saying is choosing the pharmacy, the right pharmacy matters. And we've all been there. I worked in a pharmacy for 21 years. I worked for one pharmacy for 21 years before we started MedsPLUS. And we've been there. The long lines, the waiting on hold for a while to get someone to answer. Your medication may or may not be in stock. You feel like you're being rushed through the process. Again, it's just transactional. It's not relational. And you may feel like just another number in the system. But when it comes to your health, you shouldn't settle for that. You want to go to a place where the pharmacy motto is it's more than just pills and prescriptions. It's about people. It's about prevention. And it's about being present right here in your community. We often talk about this, when we're out in the community and people are asking, where are you located? We'll say we're in downtown Birmingham. And a lot of times we get the thought, well, downtown, that's not convenient for me. Or, I have a pharmacy right here in my community. But is that pharmacy a part of your community, or is it just in your community? And that makes a difference. How are they contributing to the well-being of your community? That makes a difference. One of the reasons we chose downtown was because during our time serving during COVID, we touched all the communities of Birmingham. We were in almost all 99 neighborhoods of Birmingham. And we knew that we wanted to stay connected to all the neighborhoods that we could. And so when we were choosing a location for our pharmacy, we knew that downtown would be a good location because it is centrally located. And while it may not be convenient for you to come to downtown for your pharmacy services, we've built our services so that we can assist anyone. We have patients from McCalla to Chelsea to Roebuck to Adamsville. So that means that if you live anywhere between us and those places, we can help you with your prescription needs. And we do that through our delivery services, through our blister packs. So you're not getting phone calls every other day about a prescription being ready and it's not the one you necessarily thought it was. All of those things, we've built our pharmacy and we built the services here because we were in those community pharmacies and we saw some of the downfalls. And so we wanted to build our business to address those issues. So now I want to talk about what makes MedsPLUS different. Here's the thing. We don't just check boxes. It's not about profit margin. It's about assisting people with their prescriptions so that their outcomes improve. So it's not just about dispensing your blood pressure medicine and hoping you come pick it up every 30 days or every 90 days. It's about ensuring, number one, that you're on the most appropriate blood pressure medicine for you. Because not all medicines are created equally and not all medicines behave in individuals the same. So we want to make sure that you're on the most up-to-date regimen possible for your health condition. And we work with you and your healthcare provider to do that. But here's the key. So we don't just check the boxes, we show up. I can't tell you how many times we've been out in the community or people see us at events in and around Birmingham and they say, we see y'all everywhere. Y'all are everywhere. And we hope that that resonates with people and that we show up. If you invite us and our calendar is clear, we're going to make it our mission and try our best to be there and show up for the community. We're right here in the heart of downtown Birmingham, but we show up across all neighborhoods. We have a team that is focused on educating, supporting, and advocating for your health. I was at the diabetes class earlier, and Dr. Jennifer was talking to a young lady and asking her, what did you learn out of this session? What did you learn by coming to these education classes? And she was like, the best thing I learned, and Dr. Jennifer said it over and over, is you are your own advocate. You have to advocate for yourself in the healthcare system, because if you don't, oftentimes no one else will. And I don't want to put down doctors or hospital systems or anything like that, but we know that we need to advocate for ourselves to get the best possible care that we can. So from chronic disease management to diabetes education to genomic testing and wellness conversations, MedsPLUS is more than just a pharmacy. We're your health partner. We're your safe space. And we're proud to be your neighborhood resource, regardless of which neighborhood you live in. We've hosted vaccine clinics, community-based diabetes education. We've hosted health fairs and wellness clinics. We've partnered with schools, churches, even businesses. And we're not stopping anytime soon. This is just the beginning. Now, what does it mean to be a community pharmacy? We know that community pharmacies are often in the communities that they serve. So if you live in Bessemer, you may have a community pharmacy in Bessemer. If you live in Ensley, you may have a community pharmacy in Ensley. But what does it mean to be not only a community pharmacy, but a pharmacy that is a part of the community as opposed to just being in the community. It means knowing your name. It means answering your questions without judgment, addressing your concerns. It means taking care of your parents, your children, your whole household with compassion and commitment. So whether you're looking for a new provider on your weight loss journey, a pharmacist who explains your medication in plain English, or a place that feels like home, MedsPLUS is here for you. I want to say this very clearly. That's one of my favorite phrases from Mayor Woodfin. Let me be very clear. We're not just in the business of prescriptions. We're in the business of people. And you deserve a pharmacy that treats you like a whole person, not just a profile or a prescription number. So here's what I'd like for you to do. First, call us. Our number is 205-650-4636. Our pharmacy team is here to serve you. Often people ask about, what does it take to transfer? How can I use y'all as my pharmacy? It is as simple as a phone call, 205-650-4636. Give us a call. Let us know that you want MedsPLUS to be your pharmacy partner, and we take it from there. The second thing I want you to do, visit us. Oftentimes you'll come downtown. There's so many new restaurants and bars and all kind of things going on downtown Birmingham. If you're in the area, stop by. We're right in the heart of downtown Birmingham in the new South Federal Building. Our address is 215 Richard Arrington Jr. Boulevard North. We're on the 8th floor of the new South Federal Building. DM us. We're always on social media, so send us a direct message, send us an inbox message, and we'll get back with you. And let us know that you're interested in what services we offer that may benefit you or your family member. So whether you need a flu shot, a medication consultation, or a fresh start, we're here to serve you with excellence. We're MedsPLUS. We're your plus in health. Don't forget that. We're MedsPLUS, and we're your plus in health. Thank you for watching today's MedsPLUS Medical Minute. I ask that you share this with your friends and family on social media, people that you feel may benefit from the services that we offer. Be sure to follow our page, and if you missed any part of this presentation, you can go back and watch it on our MedsPLUS Consulting YouTube channel. And again, we welcome you to stop by the pharmacy at any time, Monday through Friday, 9 to 5, and we hope to see you soon. Thanks for watching this week's MedsPLUS Medical Minute, and we will see y'all next week.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Empower your health journey with a pharmacy that puts you first. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center.